Perfect. So today's live session is all about eye health and glaucoma per se. So this month is Glaucoma Awareness Month, and we are going live with a specialist and a doctor, Dr. Saiban Sethi, who is a senior ophthalmologist at Arunodaya Deseret Eye Hospital. And we all know her. We have seen her in the live sessions, in the interviews, and she is loved by each one of us. And she is a very good doctor and a beautiful person. So last time we did a live with her, and all the moms to be enjoyed the live session so much. So today we'll be going live with her again, and I'll just request her to accept our live invitation.
Perfect. Thank you so much for coming live with us again. And we
Thank
welcome
you.
you to today's live session. And we are honored to
Thank
have
you.
you here. And we have so many questions on glaucoma. And, our women's health community loves you as a guest. So they, sent us so many questions, which we have added as a rapid fire, questions line today. So
Right.
let's start.
Yes, absolutely. Thank you for having me and thank you for your kind introduction. So, glaucoma is what I specialize in, so I'm thrilled to be talking about it. So, let's start.
Perfect. So, if you could just give a, brief introduction about what glaucoma is.
Okay. So, glaucoma basically is a disease of the nerves of the eye. Now, when I say nerves, the eyeball is connected to the brain with the help of a nerve. And this is a connection basically which enables the brain to interpret what your eyes are seeing. So, if this connection is, let's say, weak, or if the nerves are damaged, no matter how healthy your eye structurally otherwise looks like, you will not be able to see, or your vision will be compromised because of glaucoma. So the baseline is that the nerves of the eye get affected. Now, there are various reasons for glaucoma. Most commonly, it happens because of high eye pressure. Now, the eye pressure in the eye raises. How? Because the eye has a certain amount of fluid which needs to be produced and drained at a certain rate for it to, cause a harmony inside the eye. Now, when this fluid is produced but not adequately drained, it just collects and accumulates inside the eyeball, which is anyway a closed chamber, and it causes a rise in eye pressure, and that is what causes a compression of the nerve, and hence the nerve cells slowly they start weakening or dying, and the glaucoma sets in. Now, initially in glaucoma, the vision is affected from the periphery. So when I look at you straight, I am still aware of what is on my right, what is on my left. Not exactly clarity wise, but then quantitatively, yes, I have a 30-degree visual field around me and I'm aware of my surroundings. So now this is basically the peripheral vision which gets affected in glaucoma first. And then from the periphery, it comes and affects your central vision in the end. So yes, it is an irreversible disease. Once the nerve is damaged, it cannot be revived. So an early diagnosis is of utmost importance in glaucoma if you want to save the amount of vision you have. See, very often we get this, from our patients that, nothing seems to be wrong. I just came for glasses and you're telling me I have glaucoma and I need, a laser or eye drops for the rest of my life, all of that. So it is stressful for patients to know, but it's equally important for them to know that what we are doing is we're not curing anything. We're preventing your eye from, blindness in the future, or even a compromised vision in the future. So I think the message that needs to be put out there is that while your eyes are healthy, please save it from deterioration because of glaucoma. It's not when your eyes are blind that the doctor or anybody can do anything about it. That's not possible. So a revival of a blind eye due to glaucoma is not possible. So as long as the eyes are healthy, they're able to see. And if your doctor says that you have glaucoma, please go ahead and treat it. Follow up, use your eye drops the way they're instructed to be done, and prevent the vision from getting lost.
And you just said that, people come in for glasses and they, get to know that they have glaucoma. So are there any indications or signs and symptoms that they can look out for to detect that if they have glaucoma or not?
So now patients themselves, see, 80% of our patients are symptomless. in glaucoma per se. And when I say symptomless, they basically in their early to moderate stages of the disease, they don't really know that there is anything that's wrong with them because the peripheral vision is probably affected, right? And a peripheral vision is not really something that we utilize on a day-to-day basis or we challenge on a day-to-day basis, unless of course you're into professions like a pilot or you're a driver or maybe like a sportsman, and you need to be aware of what's around you. So on a regular human being really doesn't challenge their peripheral vision that very often. So it is for 80% of the patients is symptomless disease. Yes, there are a certain segment of patients who need to be a little more careful with their regular checkups because they can also have a symptomless disease, and their propensity of having the disease is probably higher than a regular person. And these are people who have a family history of glaucoma. These are people who are suffering from diabetes or hypertension, or even above the age of 40, the risk of glaucoma increases. Patients who wear thick glasses, maybe a high minus number or high plus number. Patients who are on certain drugs like, let's say, steroids of any kinds. It could be a topical steroid ointment, or it could be an inhaler for asthma of whichever kind. Then even patients who suffered from any trauma in the eye. So all these segment of patients need to be a little more watchful about glaucoma in their life. And as far as the 20% of patients who may have symptoms, the symptoms can be either subtle or they can be very, very evident, very pronounced. Now, the subtle signs are maybe mild transient blurring of vision. It could be frequent change of glasses, or the major the signs of glaucoma where you're actually in an acute attack of glaucoma, or you have a very high eye pressure which has reached that stage. You can have eye pain, you can have headaches. It goes to be that severe that you'll have nausea, vomiting. So those signs are difficult to miss when your eye is absolutely red and hard. But the rest of the times, 80% of the times, it is a silent thief of vision.
Okay. And you just mentioned that we cannot reverse glaucoma. So, can it be cured in any way, or like through surgeries or any other thing? Is it a lifelong condition that stays with you forever?
So yes, of course, it is a lifelong condition. Now, when I say lifelong condition, so is your diabetes, so is your hypertension. So once it is diagnosed, it stays with you for life. You cannot get rid of it. But yes, you can keep it under control. So similarly, glaucoma can be treated. It cannot be cured. So you can't get rid of glaucoma with any surgery, with any interventions or medications, but you can just keep it under control. In spite of that, glaucoma is a progressive disease. So there is no one fix for glaucoma. It doesn't mean that you operate for glaucoma and your glaucoma ends, or it will never progress from here on. That doesn't happen. If at any point you need surgery, probably you reach that stage where medicines are not working or they are inadequate for your eye pressure to be within the certain range that we want it to be, so surgery is indicated. In the future, maybe more medications need to be added. In the future, maybe another surgery is required. So this process goes on. There are some patients who are fast progressors, some who are slow progressors. So slow progressors usually have a very good prognosis, in the sense most of them can be very well managed with just eye drops. Patients who are diagnosed late, the glaucoma is diagnosed late, they require surgery maybe earlier on in their disease process. If the patients are fast progressors or aggressive glaucomas, secondary glaucomas which are caused due to some problem, and it's not just a genetic primary glaucoma, those patients need surgery more often. So there is no one fix, there is no one cure. At every stage, your doctor decides what should be the right modality of treatment, and the options of treatment are either medicines, laser, or surgery. The different types of surgeries, we can talk about that later. And whatever is required at that stage needs to be done. If eye drops are given, it's very important that you adhere to the timings of the medicines, you're regular with it. Falling out of eye drops, not taking them regularly, all of this can actually deteriorate the glaucoma, and also regular follow-ups. So these two things are extremely important. Even if your eye pressure is controlled, even if you're putting eye drops regularly, whatever stage you're in, depending on that, your doctor decides how frequently you need to visit them, and this is a commitment for life.
Right. And what is acute angle closure glaucoma? Is it a type or a treatment modality?
So there are basically broadly two types of primary glaucomas. One is, so like I said earlier, the problem with glaucoma is that the drainage system is faulty, right? That's why the fluid is accumulated inside the eye and it cannot flow out. Now, in a angle closure glaucoma, which is what you asked me about, the access of the fluid to the drainage angle itself is blocked. Okay, so you have a drain which is probably functioning, but the water cannot reach. Okay, so that is angle closure glaucoma. That means your drainage angle is blocked. Then the other variant is an open angle glaucoma, wherein the access of the fluid is there. It's sitting right on the drain, but the drainage is defective or blocked from within, and even the onward channels, and so it cannot drain. So these are the two basic variants of glaucoma. Now, in angle closure glaucoma is a little more serious than open angle glaucoma, and because a patient can, if not treated in time, can have an acute angle closure attack, and that is what I said can exhibit as a very as a medical emergency. It's actually one of the very few medical emergencies in the eye. So you will have a red hard eye, severe pain, headache, vomiting. So yeah, so that is the acute attack that you want to avoid. So if an angle closure glaucoma patient has been diagnosed, they must undergo a laser, and a laser is what opens up the angle. So at least the access of the fluid to the drainage angle is re-established with an angle closure disease.
And can glaucoma be prevented by some measures, some preventive measures?
So ideally not. See, if you have a propensity for having a primary glaucoma, it is genetic. It's written in your genes, so you can't really change it. It will manifest at some point or the other. But secondary glaucomas, of course, you can prevent. So if you are, let's say, diabetic or hypertensive, keeping your systemic conditions in control. Also, if you have a family history, be a little more mindful about regular follow-ups, regular checkups, even if you are normal. Then even patients who are on steroids, they have a high chance of having glaucoma. So, even patients who have had any sort of eye injury. So preventing all these other secondary causes of glaucoma can reduce your risk of having glaucoma. Now, if you do have a glaucoma, how you can prevent it from deteriorating is also a few lifestyle changes you can make is, for example, when you're doing yoga, you shouldn't be doing certain postures which put your head below your body level, or any very strenuous exercises. Do not drink too much water at the same time is also something that we recommend to our patients, because very often you see people, they get up in the morning, they want to drink lots of water to flush out their gut and think that that's good for them, but for glaucoma patients it's not. So there is no limit to the amount of water you drink, but not at the same time. It should be divided into different divided doses in the day. So yes, you can do certain things, certain lifestyle changes to prevent secondary glaucomas. But if it's genetically there, it's there, it will manifest. It's better to just get it detected early so that it can be controlled without any surgical interventions very well. And the prognosis is very good when it's diagnosed early.
And are there any specific add-on dietary instructions or recommendations that you would like to give that can help reduce the risk of glaucoma, or people who already have glaucoma, can follow the dietary recommendations?
Hmm. So, see, patients who have glaucoma, we do have some neuroprotective agents that we give them, but there are no specific, let's say, hardcore studies that tell us that this is better for glaucoma patients. It prevents progression, or it will prevent the patient from going blind. There is no course evidence like that. But yes, placebo effect, it is better because physiologically, antioxidants, nitrates, anything that increases the ocular blood flow, the blood supply to the optic nerves, these are all protective to the optic nerve, which is what you're trying to save in glaucoma. So things which are rich in antioxidants are all your fruits and vegetables, especially the green leafy vegetables, the colored vegetables. Then you also have supplements like ginkgo biloba extract. You have citicoline. So we do have certain capsules also that we prescribe to patients where we feel that the progression is happening too rapidly, or if they're in an advanced stage of glaucoma. Over and above that, also one thing that I'd like to mention is very importantly, see, most of our geriatric patients are who are the ones suffering from glaucoma, and these are also suffering from comorbidities like hypertension. Right? Every second person after the age of 60 has hypertension at some point or the other. So now taking an antihypertensive medication at night is supposed to be, going against your glaucoma, which means that any which way when you're sleeping, your nocturnal blood pressure is lower than what you would have during the day. Now, on top of that, if you are taking medications just before going to bed, antihypertensive medications, this is going to further reduce your blood pressure, and reducing your blood pressure also means reducing the blood supply to the nerve. So during the night, during those hours of the day, your nerve is actually, suffering the insult of low blood flow. So if you can discuss with your physician and get your antihypertensive medication, your BP medication shifted from night to sometime in the day, that also is very protective in cases of patients who have glaucoma already.
Got it. So these were some of the questions that we had in our mind. Uh, Coming to the community questions that people, asked about glaucoma, it can be a rapid, answers, or you can explain in one line or something like that.
Sure.
So somebody has asked that can glaucoma lead to blindness?
Yes, of course. Glaucoma can lead to blindness if it's not picked up early on in the disease process. And because it's a silent thief of vision, very often by the time the patients get to know that there is some problem in their eye, their stage of disease is already advanced. And at that point, it's probably, if it's a fast, aggressive glaucoma, it's difficult to save their vision. And once blindness sets in because of glaucoma, it's permanent. So it can lead to blindness. So the message out there should be that get your regular checks. If you are diagnosed early, your prognosis is very good, and we can guarantee your vision for the rest of your life if you follow our instructions.
And not follow the social media, messages.
Absolutely. Yeah.
Okay, so the next question is, somebody wrote that they have, an environment where they have a lot of stress and anxiety, which triggers a lot of stress and anxiety in their life. So can those, factors, psychological factors, trigger glaucoma or eye health in general?
So they will stress will not cause glaucoma. No, I disagree with that. But yes, if a patient who already has glaucoma, stress will definitely cause harm, because stress overall will increase your blood pressure. It may indirectly also increase your eye pressure, and that's why there is a lot of buzz about meditation in glaucoma. So there are a lot of articles written, a lot of talks in conferences about how meditation is protective for glaucoma, because it's all about removing stress from your life. So yes, psychological factors, I think, have a very, very powerful effect on our general well-being overall.
And there is a diabetes community as well. So a common question, can diabetes also trigger eye health or glaucoma?
Absolutely. So I think diabetes is one of the worst diseases when it comes to glaucoma, comes to eye diseases. because it can affect almost any part of the eye. It can affect the retina, it can cause bleeding in the backside of the eye, it can also trigger glaucoma, it can cause a very dangerous form of glaucoma called neovascular glaucoma, which happens as a result of bleeding in the retina. So, diabetic glaucomas can be very aggressive and dangerous and very, very difficult to handle, even surgically. And very often, these patients who have uncontrolled diabetes, or even if it's controlled, the duration of diabetes also matters in how it will affect your eye. So, the longer you've had diabetes, even if it is controlled, you can have eye diseases, including glaucoma, and you must get a regular screening done, even if you're a diabetic. If it's normal, maybe once a year. If you have some subtle changes due to diabetes, then maybe once in 6 months.
Got it. And are there any exercises for eyes, or exercises that can also help in glaucoma?
See, exercise, particularly for glaucoma, no. But in general, low impact exercises are good. And low impact means no strenuous exercise. It could just mean 30 minutes of a walk, or maybe running. Yoga is helpful. So, exercises in general, yes, they do calm you, they do reduce your eye pressure, and as long as they are not vigorous and strenuous.
The next question we have is, can smoking or alcohol? I'm merging both the questions. So one was, can smoking trigger eye health, and can alcohol affect glaucoma?
So, yes, for both. Smoking is bad because smoking can damage your retina as well as it can weaken your nerves. And it even alcohol is neurodegenerative. So all of these are going to weaken your nerves, and yes, so it's going to cause blind spots in your vision. It can cause low vision. It can cause color contrast sensitivity impairment. So alcohol and smoking overall can also induce changes in the retina. It can also damage your retina, which means directly affecting your central vision. So both smoking and alcohol are extremely bad for your eyes.
Got it. And can children also get glaucoma? If yes, then is adult glaucoma different from child glaucoma?
Yes, children do get glaucoma, congenital glaucomas. However, they are very rare. Maybe one in 10 lakh patients, they do have congenital glaucoma. If it runs in the family, if you have any birthing difficulties, if you've had a difficult birth or any infections during your pregnancy, consanguineous marriages means marriages within the family. So all of these causes can lead to childhood glaucoma, the kind of glaucoma that the babies are born with. Now, it is very different from adult glaucoma in many ways. So, when the child is born, it's usually very evident that that the child has glaucoma because their eyes will be much larger. It can be in one eye or both eyes, and they are very typically blue in color. So, the baby's eyes are large and blue in color. They find it very difficult to tolerate light. They have photophobia. They have frequent blinking of eyes. They have continuous watering in the eyes. So all these are telltale signs that the kid has glaucoma. Now, the thing with childhood glaucoma is that the only permanent treatment is surgical treatment. You cannot control a childhood congenital glaucoma with eye drops, which is what we normally do with adults. With adults, the first line of treatment is eye drops. But with children, it has to be surgery at some point or the other. Some surgeons might like to wait until the child is a little older, or maybe some other, whatever reasons that you're delaying. In the interim period, you can control with eye drops, but surgery will be required. And another good thing is that childhood glaucoma is reversible. So until the age of 6, you can actually, if you we have been discussing very extensively how glaucoma is irreversible. It can cause blindness for life. But in childhood, if the surgery is embarked on at the right time, at the right stage, childhood glaucoma can be completely reversed back to normal. The patients can live a normal life. But yes, of course, the childhood will be, the child will be a little different because they have to look out for glaucoma worsening for the rest of their life. That's how it'll differ from being a normal child without glaucoma.
Okay. And my last question was about eye drops. So you just mentioned that the first line of treatment is eye drops for adults. We have
Yes.
one more question that we just got from a community member. So they use a lot of phone and they have a very bad screen time, say, 9 hours or something like that. So can screen time or, extra usage of phone or, all these laptops and stuff can cause glaucoma or trigger glaucoma?
So, phones directly, the only way that they affect your eye is either by inducing or worsening the eye number or causing dry eyes or maybe fatiguing the muscles of the eye. So, this is called a computer vision syndrome. Glaucoma is not a part of it. Phones cannot cause any disease in the eye or worsen any disease in the eye unless, of course, it is a part of the computer vision syndrome. So directly, no. But indirectly, of course, like I said, see, phone usage or over usage is somewhere related to stress. And stress doesn't always mean mental stress that you have to be having a explosion in your life or some sort of tragedy in your life, but even physical exertion. See, these days we're either working on our computers or when we take a break, we're back to our phones. So even the off time from the screen, which is official, has to be there, is also on the phones, which is, your entertainment. And at night, we're also watching TV. So it's very much a 12 to 14 hours of screen time exposure, even if you feel that you're only going to work for 6 hours and on the screen for 6 hours, but that's not actually true. So yes, stress overall affects your general well-being. It affects every part of your body. It'll affect every disease that you have in general. So I would strongly recommend to limit that.
Got it. So that was the last question that we had. Thank you so much for coming live with us. Any one quick message that you want to, give out to people that we shot last time also? Any
Yeah.
one quick message, to people about their eye health or health in general? Anything?
So I think this is an important message that this is a question that I ask patients very often. So when I ask them, do you get your regular checkups done? They're like, yes, of course, we go for a master health checkup once a year. So I'm like, why do you miss out your eyes? Because master health checkups actually don't include eyes most often, is what I've seen, but they don't have an answer to it. So patient's perspective is, as long as you can see well, your eyes are okay. So preventive steps towards your eye health is very, very low in our community. So that is one awareness that I would like to bring out to everybody. And if you see logistically, I think anybody who is below 40 should go for a regular eye checkup once in 5 years. If you're between 40 and 50, go every once in 2 years. And above 50, go annually for an eye checkup. Because you're bound to have some sort of comorbidities which might affect your eye, which you may not be aware of, but it can be picked up on a regular checkup and it can be treated very well if it's diagnosed early. So yes, so watch out for regular checkups. Glaucoma, like we say, is a silent thief of vision. So believe your doctor when they say you have glaucoma. It needs to be prevented, needs to be stopped where it is, and don't think that this is something that you don't feel, so you don't have.
And we have a very, very interesting question. Uh, you just, posted a picture about your achievement. You got an award, and
Right.
congratulations on that.
Thank you.
Somebody has wrote that any tips for aspiring doctors to get, all these awards and, get recognized in the medical degrees, just like you. So they are adoring you for that.
How sweet. How sweet. Thank you so much for that. I think, see, it's very important to continually reinvent yourself, which is what I don't stop doing. So whether it's, adopting new surgical techniques, whether it's, going for more training to sharpen your skills, whether it's writing papers. So learning never stops. And I think as long as you're a student, as a doctor, you need to be a student all your life. So, somewhere or the other, yes, recognition will follow, but I think you just need to be passionate about what you're doing. You need to be, watchful about what's new, what's out there, what you can try. Take a few risks. Go ahead. Don't be in your comfort zone. Get out of your comfort zone. And also, see, these days it's very important to just be very well aware. There is so much material. There are so many conferences. There are so many awards. There are so many fellowships, grants, so much you can apply for. So I think there is enough for all of us to sort of, achieve, get under our belt and feel happy about, because at the end of the day, it's motivation for doing better from here on also. And it doesn't stop there. So just generally be a part of academies, see videos, go through websites of, read journals. A lot of ideas come from there. So this will be my message to aspiring doctors, that just don't stop learning.
And you are an inspiration for that. Everybody who looks up to your profile and who comes to your profile often see how you're breaking every barrier. Even as a mom, you're doing so much, so well.
Oh,
It's
that's
always
so
fun to
humbling.
watch you.
That's so
We
humbling, but long way to go. Long way to go.
absolutely, and we wish you luck for that.
Thank you.
Thank you so much for coming to our live session and for being a guest. We'll see you again, and thank you so much for taking out
Absolutely.
the time.
Thank you so much for having me. Thanks a lot.
Thank you.
Bye.